She might get some parents with the breakdown, but I'll let you.
Okay. Well, thank you again, everyone, for joining. I'm Adam Raymond, the Communications Director at the Kentucky Center for Economic Policy. And we're here today to talk about childcare, a major childcare survey that we did with our partners at the Kentucky Voices for Health, and the need that the state has right now to make sure that families can continue accessing affordable childcare. So we have 4 providers on the call with us today, along with a colleague of mine from KY Policy and some representatives from KVH. And we will go ahead and get started. We have a piece that will be published on our website by the time this call is over that I'll send out to everyone along with a press release, but you'll be able to find it on kypolicy.org by the time we're done. And yes, so let's kick it off with Dustin Pugel from KY Policy.
Hey, everybody. Yes, I'm Dustin Pugel. I'm the policy director here at the Kentucky Center for Economic Policy. And for the past 4 years, we've really seen in stark terms just how important childcare is for our youngest kids, their working parents, and the economy as a whole. It's been so important, in fact, that Congress, through 4 large federal relief bills, sent over $1 billion to Kentucky's childcare sector just to keep them whole during the pandemic and subsequent downturn. The largest portion of which was the American Rescue Plan Act, or ARPA. But what we found is that these funds didn't just prevent a collapse of the industry, which they absolutely did. They also allowed us to advance the industry in important ways through availability, affordability, and quality through $330 million a year in federally funded policy improvements. But those funds have either already expired or are going to expire by the end of September, setting up an unprecedented fiscal cliff for the entire childcare sector. While we know that this cliff is fast approaching, we weren't sure how it would affect the industry. So we at the Kentucky Center for Economic Policy, along with our partners at Kentucky Voices for Health, sent a survey to all state-regulated childcare centers in the Commonwealth and heard from 770 owners and directors representing about 40% of the childcare capacity in the state, and from all but 3 counties in the Commonwealth. And what they told us was deeply concerning. We learned that 4 in 10 respondents reported being understaffed and that they're serving 21,000 fewer kids than they would if they could hire enough. This is despite the fact that nearly 9 in 10 use the federal funds to improve wages, which are still very low compared to other industries. Almost 60% reported that federal funding from ARPA kept their centers from closing over the last couple of years. When asked what they expected would happen once the federal funds ran out, the most likely scenario was that they would have to raise tuition, which half of families already find unaffordable. After that, providers anticipated having to cut wages, enact layoffs, and an alarming 199, roughly a quarter of all respondents, reported that the likeliest or next to most likely outcome is that they would have to close their program altogether. Childcare is indeed at the cliff right now here in Kentucky. As we approach this $330 million fiscal cliff, lawmakers in Frankfort are deliberating on the next biennial budget. Historically, Kentucky has not invested much in childcare. Funding for childcare is roughly 20 times less per child in childcare than it is for K-12 education. But the childcare cliff we're facing is serious, and it will require significant investment from the general fund in order to avoid. As the politicians in Frankfort decide how best to invest in our people over the next 2 years, my hope is that they will listen to the 770 childcare directors and owners who shared their concerns in this survey and make the kind of investment in our children, our families, and the economy that meets this moment. So with that, I think we're going to hand it over to our first childcare provider.
Yes, Krista Hughes, take it away.
Good morning. My name is Krista Hughes. I am the director of Hickory Grove Daycare Preschool located in Independence, Kentucky in Kenton County. I am in this role because when it comes to childcare, I believe that every child has the right to feel loved and supported in an environment that induces creativity and growth and learning. And I believe that parents have the right to childcare that is trustworthy and supportive to their family unit. When I speak with families about why they chose our center in particular, the answer is almost unanimously because they can genuinely see that we love and care about their children and are invested in their family. I believe that excellence in childcare is a foundational element, not to our community just here in Kenton County, but Kentucky as a whole. To say that the pandemic impacted childcare facilities is an understatement. What it really did was bring to light the necessity of childcare in our communities. The most significant impact the grant funds had on our center was the ability to increase pay for our staff. Childcare is a notoriously low-paying job that is both hard mentally and physically. And as a direct result of this, we see it as an industry that has a high turnover rate. The grant money at my center was specifically used for payroll so we can invest in our greatest resource, our employees. Without these funds, we would have definitely faced cutting program, but most likely we would have been closing our doors. Knowing these funds were going to end, we did our due diligence and prepared our center as best financially as we could to maintain current pay rates while staying with our current programming. It's my job as a director to make these notoriously low-paying, high-stress jobs a desirable job opportunity, which is no small feat. Just this past September, after months of advertising positions and trying all my typical hiring routes, I was once again faced with the thought of, do I need to cut programming or do I need to increase pay? And I made the decision to increase pay for my staff and all incoming employees, because I fully believe in what we are providing for our community. Because of this, I have already had to do a 5% tuition increase for the 2024 calendar year. And with the grant funds no longer coming in, we would be looking at another significant tuition increase for our families. I believe that if I walk back pay, I'm going to be walking my employees out the door. There's so many higher paying opportunities popping up in our community. And my goal is to not just have employees who are looking for a job, but are invested in the children and families we serve. What these funds mean to my center is that the families of our community have a place where they can trust for their children. And I believe that all Kentucky families should have that right, and it should be the norm in childcare. Thank you.
Thank you, Krista. And so now Cora Beth Brown, a child care director in Hopkinsville, will speak.
Yes, my name is Corbeth Brown. I am the owner of the Children's Academy located in Hopkinsville, Christian County. I think Ms. Krista did a great job of explaining kind of where we stand in this process. I will say, like Ms. Krista said, we have been named Best of Western Kentucky the past 4 years, my child care center. The reason we do this is because we love it. It's not because we make a bunch of money, and we understand that, especially in the roles that, like, as owner and director, we're not here for the money, but we cannot be open, and we definitely would have closed without those funds. Just like Ms. Krista said, we also used all of the funds for payroll. None of it went unused. We also had to raise tuition rates we actually charge more than our county will provide for child care assistance. So even families that cannot afford child care at all, they still have to pay an overage fee just to attend the Children's Academy, because I have no choice but to raise tuition rates. With hopes of the funds continuing, we will not have to raise child care tuition fees again, but I'm afraid that I'm going to have to raise the fees again. And I'm sad to say that I will lose a lot of families just due to them not being able to afford childcare. And then looking at big picture, if they don't have childcare, they cannot work. And that's what I hear from families all the time. I can't afford childcare, but I can't get a job. And then ultimately just hurts our economy in Hopkinsville, Kentucky even more. We have so many people needing a job, needing to, be hired, but they don't have childcare because I'm at full capacity, which thankfully I have not had the staff turnover because I have been able to raise their pay rate and keep that pay rate. But it is very important that I am able to keep that pay rate and you know, and continue to provide the high quality childcare that we do. But I'm sad to say if we we don't have the funds to continue, I will have to raise tuition rates, which ultimately I will lose a lot of parents just so they cannot afford it. So then they cannot work. So then it just hurts us all the way around. So we have been super grateful and blessed with those funds. Well, I wouldn't be here today. That would leave Hopkinsville with 2 child care centers that have a capacity of 50. I am currently at capacity of 120. We are very underserved in Hopkinsville just due to the other centers had to close because they couldn't receive the funds. So I appreciate this time and us all coming together. I appreciate the survey. It just kind of gives us a voice when we feel like we're working so hard to keep this going. And it's just sometimes kind of it's hard to keep pushing when we don't have that support from the state. Whenever we know big picture, we do play such an important role in the future and the community as a whole. So I appreciate this time for us to kind of share where we stand, and I hope we can make a difference.
Thank you, Cora. We appreciate you. Next provider to speak is Brittany Ritson in Frankfurt.
Hi, my name is Brittany Ritson. I am the director of Weekday Community Preschool here in Frankfurt. Actually, this is my first year here, so coming in with all of the money that has been able to be established to us has helped us grow tremendously from what I have learned from previously. We went a while with not having a full-time director here, and these funds have made it to where the school could have a full-time director that they were not able to have for a while being. There was a teacher who was also a teacher as well as being a director. So this has opened a role for them to be able to have me here and make sure that the school is taken care of that they did not have before. I do get nervous about the funding coming to an end because, as the ladies have said very well, we use that money to pay our teachers, to pay our staff, and to make sure that we are able to pay our teachers what they need, because we do know that childcare is the money is not there. You do it because you love it and because you have that passion to do it. I can't say that we have a high turnover here. Some of our teachers have been here 8 to 10 years, which I am beyond thankful for. But I feel these funds have been able to give us what we need to keep them here, to keep them established with our community. And without that, I do worry that they may go someplace else, because the funds are low and these teachers are here to make sure that they are giving the children their absolute all and giving their family everything that they can. That is what my passion is for being here as a director. I want to make sure that our teachers, as well as all of our children and our family, are taken care of. I want our families to come in here and know that they are sending their child to the best place that they can. And if we don't have those funds to be able to continue paying our teachers, I'm scared that we lose that. We have been named Frankfurt favorite quite a few times now, and I don't ever want to have to think about us not being able to do that, not being able to take care of our teachers and our staff. The federal funds, like I said, has helped our salaries. It has helped us have a full-time director. We were able to take care of a couple things in classrooms that were completely outdated. And if we wouldn't have had those funds, we would have had the same stuff that we've had for 20, 30 years in the building. So that has been very grateful for us too. And then, like with the funds expiring, like the lady said, we have had to increase tuition for next year. We went about 4% up for next year, and I worry that we won't be able to have the great families and the support and everything that we do have right now to be able to continue to move forward, because I don't ever want it to be to where our families cannot pay for what they need for their children. So thank you guys for having me. Thanks so much for everyone else being here, the directors being here and putting out all the information for all of us.
Thank you, Brittany. And our final provider to speak is Stephanie Murta from
Yes.
Oldham County.
Yes. Hi, I'm Stephanie Murta from St. Aloysius. We're located in Pewee Valley. I chose to be a director because I enjoy, first of all, getting to know my families and being able to watch children grow and progress throughout the year, and just being a resource for my families. I feel that early childhood is so overlooked, and that people do not realize that early childhood is such a huge part of a child's life. Those early foundations, that without those, children cannot be successful. The social emotional aspects that children gain in an early childhood program are priceless. And with those funds, I was able to raise my teachers' salaries. And I have to say, all the teachers at my center have degrees. And these teachers were making what fast food restaurant workers were making and cashiers at retail stores were making. And to put it in perspective, these individuals are taking care of tiny humans when their parents are away. And my assistants, if you can imagine, were making less than that. And to be able to bring them up to the standards of living, it meant a lot to them. And I was very pleased to be able to do that. Without these funds, we are going to have to raise tuition 8% next year, which is a lot. Our preschool is located in a school for K through 8, and the school has found me an additional room away from the preschool wing to open one more room, because that's the only way I can make money is to bring in additional children. But again, it's going to be completely separate from the preschool wing. So without this money, those children are not going to get the same experience as the kiddos in the preschool area. So I just think it's very important to look at how this money serves these kiddos and what it does for parents that have to work, and to be in a quality program and how important that is for parents to have that peace of mind. So thank you to the other ladies. I think we've all made great points as to why early childhood is so important.
Thank you, Stephanie.
Thank you.
Next to speak is Emily Beauregard, the Executive Director of Kentucky Voices for Health.
Good morning, everyone. I am Emily Beauregard. I'm the Executive Director of Kentucky Voices for Health. And as a health advocate, I'm here today to talk about just how essential high-quality childcare is to the health and development of Kentucky's children. We've heard it already from these amazing childcare providers, and I just really want to reinforce that there is an absolute link between, having this really high-quality early childhood education and health. 90% of brain development happens before the age of 5. And yet Kentucky only spends $128 a year per child on early childhood education compared to $2,632 in K through 12 school seek funding. Just like access to education, healthcare, healthy food, and safe and affordable housing, access to childcare is a social determinant of health and absolutely critical to a family's ability to thrive. Kids who have access to early childhood education see lifelong benefits in the ways of increased educational attainment, higher earnings, and better health. They also face less risk of neglect, disability, chronic illnesses, and incarceration. Kentucky has a long history of struggling with poor health, but choosing whether or not to invest in upstream interventions is a policy choice. We have the opportunity to prevent disease and disability through access to high-quality early childhood education, and I implore our policymakers to embrace this as an essential path to lifelong success in health. The return on investment is tremendous, and it's worth every penny we pour into it. For every $1 spent, between $4 and $9 are returned to our economy. But families can't foot the bill for childcare alone. Living expenses are higher than wages for half of Kentucky households. The cost of childcare for a toddler is equal to 17% of a Kentucky family's median income. That means families are easily spending $9,000 a year on childcare, if not more, just so that they can work. But those earnings have to stretch so much farther, and families end up with less money to put toward healthy food, health insurance, utility bills, rent or mortgage, and all the other unexpected expenses life throws at us. There's less personal financial flexibility to save for anything, and it means more families are living on the edge. Higher tuition and tuition increase after increase for families, it's not a solution. Paying childcare workers less than the already meager $12 an hour they make on average now is not a solution. We heard that over and over today from our childcare providers and from the hundreds of providers who responded to this survey. Childcare isn't cheap, and it shouldn't be. No iPad or smartboard will ever change a baby's diaper or soothe a crying toddler. These are our children, and when parents are at work, we need to know that they're in a safe and enriching place to develop to their fullest potential. We don't have nearly enough child care capacity in Kentucky as it is now. If we don't invest enough, we'll have even less. And as a working mom, that is just terrifying to imagine. Families struggling to make ends meet won't be able to absorb tuition hikes and will be forced to either leave the labor market or find lower cost care that may not be safe for their child. Even families who have the means to pay more may not find an available spot. Already more than half of Kentucky is a childcare desert. There are typically 3 or more children competing for a single available childcare spot at any given time, and some areas have no childcare available at all. In the last decade, we've lost 46% of our childcare providers in Kentucky, and now with the federal funding ending, we're standing at the edge of a new cliff that could result in hundreds more programs closing or laying off staff. Childcare is essential to the health and well-being of our economy and our Commonwealth. The only solution is significant investment to make up for the $330 million our childcare sector is losing in federal funding. Without it, the pressure on our childcare providers, families, and employers will become a workforce crisis with ripple effects that will impact our economy immediately and the health and development of our youngest Kentuckians for the rest of their lives. The need for childcare investment in the state's budget is urgent. And we have money to prevent a childcare cliff from happening this year. That's the good news. We urge our state lawmakers to invest in a state budget that keeps childcare centers open and kids and families thriving.
Thank you, Emily. And now Kara, also from KVH, is going to finish us off.
Yeah, I'm just going to go ahead and say cosign. I also wanted to take just a second and say, think about any other industry you care about. So like we're here talking about childcare, but let's go ahead and talk about, teachers, doctors, machinists, people that do our utilities, keep us electricity on. Oh, guess what? We need childcare to have any of that. Childcare supports every industry in Kentucky. We don't have a workforce if we don't have childcare. So Ms. Corbett and Ms. Krista and Ms. Stephanie and the other providers on this call are making every industry in Kentucky possible. That to me is undeniable and something that we have to take into consideration. Anytime anybody comes in to talk about a budget number, I think there should be an additional. And to make that possible, how much do we need in childcare? For everything in our budget makes sense to me because this is what we rely on. It's also true that we do think childcare should be expensive. I mean, I think childcare should be very expensive because I want the best for Kentucky's children. I want there to be people who want to stay for 8 and 10 years. I want people who do have degrees. Like Emily said, 90% of brain development, guess what? It's hard enough to leave your baby knowing that that's happening and every moment's happening. You want to make sure that people you're leaving with are well educated and are capable, to provide the best care possible, which the providers on here are. But they're not being rewarded in our system in the way that they should be for those talents and skills that keep us all afloat in all other ways. It's also true that this cost is not borne equally across our lifespan. It is young families who need childcare. There are not a lot of Kentucky families at the highest peak of their earning capacity, like in their 50s and 60s who are trying to find a place for their toddler. I'm sure they exist, but it's not the majority. It's folks who are not at their peak earning capacity. And almost all of my friends pay more than their mortgage in childcare. You've heard the data about that. but it's real. It's true. You can ask almost anyone. There are legislators who pay more than their mortgage in childcare. And again, I'm not saying that that's not, the amount isn't wrong, but who's bearing it is wrong. Who's bearing it should be all of us. All of us at all stages of life should be publicly responsible for our children. And we should make sure that our children all have everything they need all day long, including quality childcare.
Thank you, Kara. Well, at this point, we can open it up to any of the reporters on the call who have questions, either for the advocates or for the providers. Okay, we have one here from Sarah about the survey. Dustin, you might be best to handle this if you can read it.
Yeah, Sarah's asking, when was the survey sent out? It was sent out in the first week of January. So when you get it, it'll show the span of time that folks responded to it. So it was about a 10-day period from January 4th to January 14th. It did not take into account the GOP proposed budget, which does include funding for one of the several policy improvements funded by the American Rescue Plan. But even what the House proposed is still amounts to about a tenth of new spending compared to what ARPA has been spending up till now. So we think that there's really a role for these results to influence the conversation, and we really hope that they will listen.
I'm gonna right now drop the link into the chat for the piece, which is up on our website now. So there are some results to the survey, some more context for the survey, and some graphs to illustrate some of the results too. Are there any other questions?
I'll just add quickly that there was another survey conducted of childcare providers a couple of years ago from Pritchard. I see Ben Geis is on the call. We tried to mirror those questions pretty closely so that we had sort of a time series, and the urgency didn't change much. Providers are still just as concerned now that the sustainability payments, the largest chunk of that ARPA money, has already gone away, as they were a couple of years ago, knowing that it was coming. So I think the providers on this call shared really clearly that this did not take anyone by surprise. We know this has been coming, and so I think our concern is that the lawmakers really also recognize that this cliff is coming and make a substantial investment.
So we have another question here from Sarah Ladd that I'll read out loud and let whoever might want to jump on it go ahead. For the providers or the advocates, why do you think childcare faces these challenges? Why the slow bleed? Is there a lack of respect for the industry or a lack of understanding of it?
Oh, I'm like, am I allowed to answer? Because I'll tell you what I've been told by legislators.
Yes, and I think maybe Krista has something to say after you.
Yeah. Well, maybe she's going to say the same thing. So I don't want to steal your thunder there, Krista, but I'll say that I've had legislators tell me that, basically they don't believe that it's the problem that it is, and that there's, and that their mama took care of the kids. And like, yeah, my mama took care of me a lot too, but I still had childcare on top of that. And they've also said that they don't understand where the profit goes. And I'm like, there is no profit. This is not a close call. This is not a situation where anybody is getting rich or even really doing well, right? So, but they've said that to me repeatedly. Where's the profit in childcare? And I've asked them how many 18-month-olds they can care for at once in response to that sometimes. But so there's that. That there should be a family support. And there's some legislators who believe that mom should be home and not working. And to that I say, our economy does not support a one-income household. If it did, so be it. Like if anybody wants to make that choice, that's great. I mean, go at it. It's just that our economy doesn't allow for that for most people, especially not young families. But those are three of the things that I've heard from legislators repeatedly, that it's like that family's responsibility, that there's some extra sort of profit in there somewhere that we just need to root out, doesn't exist, and that families should be taken care of, like, but not everybody has extended family in that same way, and they're not all safe. So, and I want our children to be protected and safe.
Yeah. Krista, do you have anything to add to that?
Yeah, I don't necessarily think that it's like a slow bleed. I think that what the pandemic did was just bring a light to the already existing problems, with like low pay in childcare. I don't know that unless you have worked in childcare, you fully understand the day of a childcare provider looks like. It is very demanding, but it's so rewarding in so many wonderful ways. So why do we think childcare faces these challenges? I think that's why the jobs can be hard and so rewarding, but I think it's just now coming to light, after having these funds, and we were like, yes, support us. This is awesome. We're finally getting supportive, and now that support has stopped, and we still need that support.
And I'll just say one thing that I'll highlight something Emily mentioned. Childcare has been in crisis for a long time. And actually, we had lost about 1,700 centers between 2012 and 2020. And it wasn't until that $1 billion in federal funding hit our industry that it leveled out. And really, it's maintained for the last 4 years. We have about 2,030 providers now. We had about 2,000 providers in the middle of 2020. So it has stabilized. I mean, I think those funds did what they claimed to do, which is stabilize the industry. So my question is, once that money goes away, what are we going to see? And I think this survey really highlights what we're going to see.
I'll just add that, this is the industry that supports all industries. I think that was already said. And so we need to see it as a community benefit, as a societal benefit. It's something that we all need to invest in as taxpayers so that we can see the economic and the health benefits, short-term and long-term. And if we want people working and contributing to, our communities in that way and to our state budget, we have to have childcare available. And the benefits are immense, they're enormous. But it's hard to accept, I think, for a lot of policymakers that this should be a subsidized industry. There's no failure in that. I think it's just a recognition that it is part of our workforce. It's a support for our workforce, and it needs to be treated as such. But it's not a failure for this to be a subsidized industry. It's a recognition that it benefits all of us, and it benefits, the Commonwealth's economy. So I think that we need to just change our perception of childcare, how we understand it. It's not only a benefit to the families and the kids who participate, it's a benefit to everyone. And as far as, it looks like Kara's already answered in the chat that we have had many, many meetings with legislators. I think legislators understand that there's a need here. I think legislators are concerned, but that number is a big number. Now, the payoff, that return on investment is much larger. But that's a hard one to, for some legislators to wrap their heads around and to have, the will to put into the state budget. But we do have the funds this year. We have more funding available for this kind of investment than ever before. And that's what legislators need to be hearing.
Well, I'm not seeing any more questions. So Dustin, can I put you on the spot for a second to expand on that point that Emily just made about how the money is there this year to provide for childcare in the budget? You got it? Yeah.
Yes. Yeah. So because of a couple factors, mainly a large influx in federal funding, higher than normal inflation, and also a really robust economy, Kentucky has had a surplus every year for the last 4 years. And in the fiscal year we're in right now that will end at the end of June, we're anticipating a surplus of around $1.9 billion. So when we say the money's there, it's there and then some. Legislators could fund the entire cliff, all $330 million, and still have a lot of leftover recurring funds to invest in our other priorities. So unlike many years when legislators say we have scarce resources, there's not enough money, we have to make tough choices, this is a year where we can make big investments. And we really think that that is what the moment calls for, not only for the industry, but like Emily said, for all of society. It's something that pays dividends long into the future when we provide high quality childcare. And it's something that we really ought to do.
Can I
Thank you.
add just one thing?
Yes.
I would just like to point out that, I have kids enrolled in our public school system because I don't think there's anybody that would say that children do not have the right to an education. That's something we all believe. Learning looks different when you're talking about early childcare, but every child still has that right to excellence in education, even at the youngest age. And I think that's something that we just really all need to get behind for our younger kiddos.
Absolutely. Well, I know that many of us who are not child care providers on this call are only able to be here because other child care providers have our kids. My 4-year-old is currently being well taken care of at the YMCA in Louisville. So if we don't have any more questions, I will plan to send out a recording of this to all the reporters, along with a press release shortly after the call ends. And if that's it, then I think we can sign off. Thank you again to everyone who joined us, especially the providers, for taking time out of what I know is an extremely busy day.
Thank you all so much.
Thanks, everyone.